Well, first I'd like to welcome and thank everyone for joining us this evening. Obviously, we hope that everyone's doing well and remaining healthy and safe during this challenging time. I would be remiss if I didn't take the opportunity to first thank all of our frontline health and dental care professionals for not only all that you do, but all that you risk in supporting our health and well-being of our society during this time. So thank you all. As we said, any questions, certainly feel free to fire away, and we'll be keeping an eye on those. There's one already. Different insurances have been requesting different coding, and I have been billing 9995 and 140. Is that correct? So I think you cover that in the presentation. So we'll let the presentation go and then make sure we absolutely get to that in the end. But tonight I have the pleasure of introducing Dr. Arash Hakamian. Dr. Hakamian has graciously partnered here with Ace Surgical to share with us his journey of discovery and experiences in the field of teledentistry. Dr. Hakamian comes from a long lineage of dental healthcare providers. He's a graduate of the USC School of Dentistry. He's a co-founder and board member of the Global Dental Implant Academy, the Global Implantology Summit, the International Extraction Academy, and he lectures both nationally and internationally. He also currently maintains a private practice in Southern California. So without further ado, ladies and gentlemen, Dr. Arash Hakamian.
Thank you so much. Thank you for Ace Surgical. I am actually not only a fan, but a user, and I appreciate you guys for everything that you guys have done for myself and my practices, and really gracious of you guys to put this together and really try to help our fellow providers and our patients in this time of need. And it's a pleasure to be here with your audience. And I know we're limited on time, so I'll jump straight into it. Just a quick brief background on myself. I'm come from a family of dentists, as you mentioned, brother, father, mother, sister, everyone is in the dental community. And I've had a pleasure and really a broad experience within the field of dentistry, from teaching, lecturing on marketing. I've had several offices of my own, and really just live, eat, and breathe dentistry. And throughout my experiences, I realized a lot of the pain points that I was experiencing, which really put me in this position I am today, trying to create solutions for our fellow dentists and our patients. Just some quick disclosures. I do have some consulting, paid and non-paid positions. I am also a CEO of Dentulu, a leading teledentistry company, and you will see some slides that I use for my lectures within Dentulu. But in addition to that, I am a consultant to various NGOs, Department of Health, both nationally and internationally. So just want to make sure that is clear. And I want to go really quickly through some statistics. And I think these are going to change. These are statistics as of last year, but over 181 million Americans were anticipated not to even visit a dentist. 50% of Americans have over 30 have gum disease. 164 million work hours are lost annually going to the dentist, and 2.2 million emergency room visits for dental related emergencies. And internationally, globally, it does not get much better. And I will let you guys really look at the wide range of impact that oral health is having on our patients and on society. And, as we have already preached for decades to our patients, oral disease has a significant influence on one's ability to live, whether it's pain-free and anxiety, or the direct correlation of oral health and general health, especially now in the time when our immune systems have to be in tip-top shape. We want to make sure that we are doing our part in helping minimize oral pathologies and disease, and hopefully translating that into a more efficient and healthy immune system as well. So what are the problems that we're facing? Why do we have these statistics? And whether it's traffic or the office wait time, whether it's being disabled and having logistic issues, or having to implement COVID-19 social distancing, there are a variety of issues that we face here in the United States that have resulted in those in those statistics. And nationally and internationally, I think some of those stay consistent. Lack of access to care, whether it's financial issues and level of education, and poor diet and dental fear and anxiety, and also the side effect of the rising opioid epidemics and the medications and the havoc they cause in our patients' oral health. And so telehealth has a huge opportunity to play an instrumental role in increasing access to care. In order to really discuss telehealth and teledentistry well, I think we should have some basic definitions down. Telehealth is actually defined by different entities in different ways. But generally speaking, it is a collection of means and methods for enhancing healthcare, public health, and education using telecommunications and technologies. And telehealth and telemedicine have been interchanged for many years. The American Dental Association actually refers to teledentistry specifically to the use of telehealth systems and methodologies within dentistry. So what is telehealth? It's not a specific service, but a collection of means to enhance the care and education delivery. And we have different applications of teledentistry, whether defined by the American Dental Association or other governing bodies. It is generally accepted that telehealth can be implemented in a live synchronous format, asynchronous store and forward, remote patient monitoring, and even mobile health. Now, teledentistry and telehealth are not new subjects. And if you really look at the broad definitions, we've been implementing telehealth for over a century now. In fact, in the 1900s, when we first experienced the first EKG transmission, telephone conversations and Morse code actually were implemented to utilize within the telehealth delivery model. In 1948, community alarms, and in the 1960s, video conferencing was enabled. NASA started using it in 1970s, and as early as the 1980s, implantable sensors were utilized. The United States Army officially started implementing teledentistry in the 1990s, and it's around when we saw broadband occur. And as of early 2000s, we've had published research articles talking about teledentistry. This one refers to teledentistry as it should not only be a practice builder for local dentists, but also have the potential for helping dentists better serve their patients while increasing their own knowledge. And these were discussed over 20 years ago. Again, in 2011, another article cites that teledentistry has the ability to improve access to oral health, improve the delivery of oral health care, and lower its costs. It also has the potential to eliminate the disparities in oral health between rural and urban communities. So it's with that in mind, the increased access to care, the ability to communicate better with other healthcare practitioners, and to eliminate disparities that I want to discuss teledentistry and telehealth as we move forward. Now, teledentistry specifically is not a new concept. Again, one of the biggest misconceptions is that video conferencing or chatting are the defining characteristics of teledentistry. In fact, the biggest teledentistry company that I'm aware of that exists today is Smile Direct Club. And by definition, they define themselves as a teledentistry company. If you use CAD cams, or if you're actually utilizing even the telephone to do post-op checks with your patients, you are already using teledentistry. Now, if you have not watched the news or not followed with any of the recent statistics, you would have missed the fact that teledentistry has, and the interest in telehealth and dentistry have exploded over the last month. As you've seen in this chart, Google Trends actually can follow the amount of interest and search queries for specific terms. And here you'll see within the United States, the massive influx of attention and focus on telemedicine, and this is, not just nationally, this is also internationally. You'll see teledentistry take a huge spike, and you'll see the projected direction in which it's going. And you'll see this same spike in telemedicine, telehealth, and teledentistry, both nationally and internationally. So again, we'll want to discuss both synchronous and asynchronous teledentistry. Just to ease the explanation, I think synchronous teledentistry can be considered a real live video conferencing, and asynchronous teledentistry encompasses the ability to give second opinions, to chat, to share files, to have alerts and reminders, and even provide collaborative capabilities to professionals within dentistry and between professions as well. So some of the examples here are in the real life synchronous teledentistry, or dentist-to-dentist interactions, dentist speaking to a physician, dentist speaking directly to a patient, dentist speaking to hospitals. Real life and real-time surgical support, remote surgical support, educational mentoring, and even dentists talking directly to special divisions within insurance companies. And these are things that you should expect to see in a very short period of time. Asynchronous teledentistry, which is often referred to as store it forward, is the ability to record and review charts at a later time, the ability for insurance reviews, direct-to-consumer models, mobile dentistry, mHealth, and even in research and development. So there's many use cases that I want to review with you guys, and we'll touch on just some of them that I feel are really pertinent at this moment. And I want to let everyone know that there are really two things that you can implement immediately. There are already dental optimized systems. There are several other companies in addition to Dentulu, Mouthwatch that have really established themselves and the ability to integrate with practice management softwares. They're already HIPAA compliant. They incorporate digital imaging and really have been built to integrate well with dental systems. But there are also lots of opportunities to repurpose available technologies such as Zoom, Skype, WhatsApp, email and text messaging. And in the United States, at least for the current time, a lot of the HIPAA regulations have been minimized, allowing for consumers and doctors to utilize already available tools. Obviously, this will not continue forward, and at some point this will be reverted back to the traditional HIPAA regulations. So my recommendation is, if you are thinking of implementing a long-term strategy, to really look for and investigate a dental optimized system that is already established and allows you to share and utilize this information in a HIPAA compliant format. Short term, I think some of the most important things to be able to do is be able to deal with the stay home shutdowns and the limited access we have to our patients. These include the ability to maintain continuity of care with our patients, provide post-operative care, consult and advise our patients, our existing patients, provide prescriptions, and be able to really filter what is a true emergency and not emergency. But really, most importantly, I think that we have to do our job to keep people out of emergency rooms. With all the dental shutdowns, we do not want dental patients going to hospitals. Before the COVID-19, in the US alone, there were over 2.2 million visits to the emergency room. These are preventable dental emergencies that could have otherwise been addressed outside of the emergency room. This translates into billions of dollars of lost system to the healthcare system. And also to the patients, this would on average cost 3 times as much as they would spend within a dental office. And so implementing strategies to help existing hospitals and urgent care centers and be able to reroute some of these patients to dental offices is key. Before the COVID-19, we were very involved in implementing intraoral cameras, a digital sensor and an x-ray gun, and some basic HIPAA compliant software. And we were able to help hospitals triage patients, effectively diagnose, and instead of giving them opioids and having them go find a dentist on their own, be able to have a local dentist be involved in the process to decrease misdiagnosis, and as well be able to prescribe the right medication and then have a place to refer that patient to locally. You should actually be really interested in upcoming technology. In fact, this technology is in existence and implemented in many hospitals around the world, which is the utilization of hospital carts and actual robots that can actually go to patient by patient and be able to provide a variety of different services directly inside the patient's room in the hospital. So whether that involves the placement of kiosks in emergency room waiting areas to be able to reroute dental patients to dentists, or actually having these types of carts or equipment within the rooms to allow a dentist to speak directly to a patient. These are things that are being implemented today and that you will see a massive increase in over the next several years. And just imagine, hospitals are able to take a simple PA or bite wing. They're able to place an intraoral camera inside the patient's mouth. And this is something that can quickly and efficiently be utilized to bring in a licensed dentist and allow them to see inside the patient's mouth remotely. So we thought to ourselves, why limit this to actual hospitals? And why can't we capture some of these patients in the pharmacies? A lot of patients, before they go to the pharmacy, before they go to the hospital, they actually end up in pharmacies looking for oral gel and topical. So expect to see tons of these kiosks available in local pharmacies where patients can actually utilize telehealth and teledental equipment to be able to contact licensed doctors and dentists. In fact, companies like Walgreens, CVS, Walmart, and Rite Aid here locally are already thinking of strategies to be able to capture these patients while they're still inside the pharmacy, contact a licensed doctor, establish that patient as a patient of records, and then be able to send an electronic prescription directly to the pharmacist where the patient can get medication prescribed and they can be routed to aisle 2 to purchase the specific item that may help alleviate their immediate concern, maybe some temporary cement, or maybe a special type of flosser to get something that's jammed in between their teeth out, and then be able to send that patient to a local office. Let's consider why we have to even let patients get to the pharmacy, and let's consider what is the fastest and easiest way to get into the patient's vision, and really with the fact that there are over 5 billion people around the world, even in some of the most impoverished areas that have cell phone devices, the potential to go direct to consumers and to help patients immediately when they have that emergency or immediately when they have that question is really monumental. We started developing technology to be able to go direct to consumers because we realized that a lot of these emergencies that were going to urgent care centers or hospitals were not really true emergencies. Bleeding gums, a crown that has fallen off, is something that can be addressed through a simple video conversation within 5 minutes. And more importantly, there are situations where patients fall and have trauma and maybe a tooth got knocked out and they're trying to find answers quickly. And by the time they get to the actual hospital, sit in the waiting room area, fill out the paperwork, and then be seen by a doctor, the vitality of that tooth has been reduced significantly. So we decided to be able to go directly to consumers. These are just one of thousands of examples over the last couple of years of us being able to connect immediately with a patient, allowing a patient to download the app, or if they already had it downloaded, within 5 minutes be able to connect with a licensed dentist who is geo-tagged and matched to that patient in that area. So not only can the dentist help that patient in time of need, they can actually charge for it, and they can actually acquire a new patient who's a high converting emergency patient. And let me tell you from firsthand experience, it is a fallacy that these are patients who have no money and that cannot afford it. And in fact, I've had tons of patients who had really well-paying jobs and just simply didn't have a place to go at 9 or 10 p.m. and had an emergency and ended up finding us on our local page. So basically, you'll see here, a patient is asked whether it's an emergency. They can look at a bunch of different categories, find a dentist based on their profile. In fact, search for a specific dentist. Once they review and pick the dentist, they can actually read a little bit about the dentist, see the available timings, and then call that dentist immediately. And this process takes about 5 minutes. And you'll see here at the beginning, the patients are always asked, I'll stop this, if it's a life-threatening emergency. And if it is a life-threatening emergency, then this is something that we refer them to the hospital. And then we immediately ask them if they want to video conference with the doctor or if they want other services. And so if they press yes, they can immediately, again, look at different categories. And this doesn't have to do with just emergencies. People could be interested in a variety of different services. And so once they look at a doctor's profile, they can, again, read the doctor's profile. They can start chatting with the doctor, and they don't have to actually do a video conference. And once they're able to chat with the doctor, they can send pictures, they can send videos, they can decide to schedule a call. If they do decide to schedule a call, we get a full health history on them, and they can go ahead and talk about their allergies. They can talk about any pre-existing conditions. And we make sure that we go through this process quickly and efficiently. And all this information will be provided to the doctor so that the doctor can review these things before the patient is actually seen. There are consent forms that discuss the benefits, the risks, and alternatives. And the patient is able to sign immediately on the app and then pay for the service through a credit card. They schedule a time. If it's not an emergency, they can schedule consultation with the doctor. They pay for the video call. And this is as simple as just loading a credit card. And if they have dental insurance, they can enter their insurance information, complete the payment, and then go ahead and schedule with the doctor. That's really important for us to have the capability and ability to have different functions for each individual person, whether it's a patient, it's a clinician, and company. So, and this is something that you should see in any good company, is the separation of resources and the separation of features for the different individuals. And more importantly, the ability to download this on any phone or to utilize it directly on the web without having to download anything. So here again is a quick workflow. You'll see a patient has the option of picking video calls, actually taking intraoral pictures with some cameras that are available, shopping, and searching for dentists based on what they're looking for, not necessarily by dental specialties. Some dentists refer to themselves as holistic dentists. Some are laser dentists. And all this is meant to do is really help the consumer find exactly what it is they're looking for. So whether it's a dental insurance or a geriatric dentist, a dental radiologist, or a holistic dentist, the patients and consumers should be able to find exactly what it is that they're looking for. So they pick the category. They review the different doctors in that section. They are able to directly on the web read a little bit about that doctor, give access or remove access to any doctor, look at the time, and then be able to, again, fill out a health history form and sign consent immediately. And then here you'll see, again, on the web, the ability to enter a coupon, enter payment, or enter PPO insurance. If it's an emergency, the patient will basically be given 5 minutes to situate themselves well. And the doctor is alerted by a text message, an email, and also a push notification. This gives the doctor plenty of time to sit down and situate and, him or herself and not be caught off guard. And we want to give a little bit of a breathing room for the physicians or for the dentist to be able to prepare for these meetings. So you'll see a 5-minute countdown. And once the doctor and patient have really had the ability to communicate, now legally in the United States, and depending on which state, and internationally, I'm sure these rules and regulations will differ, patients are now able to receive electronic prescriptions directly through the phone and to their local pharmacy. It's, for us and for any good teledentistry company, it's important to be accessible through audio, video, and also be able to access your patients on tablets, on phones, and directly on the web. We've also added another feature, and these features are not proprietary to Dentulu. These are features that you'll see across a lot of platforms, and these are really helpful because now even a feature as simple as putting a widget on your website allows a patient who goes to your local website to look on the lower right-hand corner and see this little widget pop up that says book a virtual consultation. And for a dental office to implement this, it's as easy as taking a simple code like this that's available on your dashboard and giving it to your website developer, having them implemented within minutes, and this widget will appear on your website, allowing a new patient to book an appointment directly with the doctor based on the doctor's availability and to set up a virtual call. Now, these are examples of intraoral cameras that have also been implemented in dentistry. A good friend of mine, Brant, and his company Mouthwatch have been really advocating the utilization of intraoral cameras, mainly for the utilization between professionals, between hygienists and dentists. And these cameras are readily available on the market. And Dentulu works with any number of cameras. Mouthwatch has a wonderful software as well. These cameras, I believe, last time I checked, were about $299, $300, and very high quality, great images. Dentulu has created some consumer intraoral cameras, which you'll see on the left-hand side. And the intraoral cameras are able to be sent directly to any patient's home. They average between $25 and $50. And so now consumers can pick up one of these cameras directly on any shelf of a pharmacy or purchase these on Amazon and have these sent to their home where they can actually see inside their own mouth and really explore and educate themselves. But if necessary, also be able to take pictures and be able to take videos that can be sent back to their professional dentist, hygienist, or even medical doctor. Now, there's an addition to these cameras that I'd like to really show, and I think this is the first time many of you guys will have seen this. This is a camera which we have added attachments to. So you'll be able to see this, and I'll let this play for a minute. So the point of these cameras is that the cameras can be sent home with any patient. They can be utilized for post-operative care. If you place an implant, if you are doing a surgery, soft tissue graft, extractions, and really honestly, beyond just surgery, you're able to follow up with your patients now and actually see inside the patient's mouth. The last example I gave you with the attachments actually allows us to provide unique attachments for fixed hybrid cases, for implant overdentures, hard to reach areas, and really allow the patients at home to educate themselves and be able to see where it is that they're cleaning. And really, and this is an example of just a follow-up protocol that we have implemented in a patient who got a dental surgery done, and be able to follow up and actually save some chair time and decrease the amount of post-op appointments. So not only is the dentist now available to monitor the patient after they leave, but the specialist, the periodontist, the oral surgeon, everyone can get involved, even remotely, and be able to follow their patient's healing and progress days, weeks, months, and really without requiring the patient to come back all the way to the office for quick and sometimes unnecessary post-op checks. Now, you'll see in the very near future artificial intelligence being implemented in apps and in teledentistry, and allowing patients to catch early cavities, early gum disease, recession, all through artificial intelligence and machine learning. And through a simple camera on a regular iPhone or an Android phone, we can now incorporate artificial intelligence to notify doctors, dentists, and the patients of potential problems early on. So you can see the plaque accumulating, and you can actually see early cancerous lesions. And this will alert the practitioner and the patient and allow them to address the issue in office. And not only will this increase, we believe, the efficiency in diagnosis and early monitoring, but it'll also help patients be more actively involved in their own oral health and really be able to see inside their own mouth and be a lot more engaged than previously, available. So, this can be done in a live format, and it could be in an asynchronous format as well. And so expect to see amazing companies, my buddy Kyle Stanley and their team in Pearl, and other companies like DiagnoCat are incorporating artificial intelligence to actually be able to help in the diagnosis of x-rays, DICOM files, periapical and bite wing radiographs. And so a lot of this file sharing will involve artificial intelligence that helps the practitioner and the patients as well diagnose things. You've already seen or heard of companies like Dental Monitoring be able to utilize teledentistry and certain equipment to assist in the tracking of the progress through clear aligners and through traditional ortho. I personally think that a lot of this hardware will be unnecessary in the future with the advancements in the cameras that are now being implemented on traditional smartphones. But the idea of incorporating remote monitoring, artificial intelligence for clear aligners, for even cavities and a number of other pathologies is going to be instrumental moving forward. Now, patient education videos are something that we can incorporate on these as well. If the patient has a telephone in their hand and they can go in there and search a number of different topics, these are educational videos that the doctors, after their consultation, can send to the patient directly in the app, available in English and Spanish. And these will really help in not only proving that the patient has been given the proper information. This is a company called Psychic, InfoStar, that I've been personally using in my offices for the last 10 years, but any number of customized patient education videos from Casey or other companies can be incorporated into this. Finally, and thank God, the insurance companies have finally followed suit. I'm very proud of the American Dental Association over the last 5 years for lobbying Congress in getting a lot of these regulations implemented. And in fact, these codes were available before the coronavirus and the current pandemic that we're experiencing. Medicare had implemented a lot of these codes long before the coronavirus, but now as a result of the coronavirus, you'll see two teledentistry codes, D9995 and D9996, that are able to be billed in addition to the traditional code that you would use for an exam, a problem focused exam. There are a few companies that are paying for these specifically on their own, but there are most of the companies who have implemented some type of teledentistry code that would be tacked on to the traditional code that you would bill. So we do have a couple of different scenarios, whether it's a patient calling a call center and then being routed from a call center to a dentist, or a patient calling a dentist directly, or a patient calling a dentist and then being routed from the dentist to a specialist. All these are codes that are currently being paid for. And in fact, the medical side have implemented codes where they can actually start billing for dental evaluations on the physician side. So this is going to really help in the implementation of teledentistry. And for proper workflow, I really recommend you snap a picture of this and really see the involvement of how the hardware and the software and the facilities and the movement of information really need to be in place for good workflow. And here, and you can see some of this on the American Dental Association's recommendations, you'll see an approach from the patient side and from the doctor's side. A doctor should be able to sign up, fill out their professional details, set their own availability, approve appointments, interact with the patient, manage their payment, the payments and insurance information, and then be able to follow up with a prescription. And this is the way that our software has been developed. And this is the way that any software you choose should follow this type of workflow. And for the patients, be able to register and sign up, review and actually identify and select their doctor, book an appointment, get a confirmation that their appointment has been booked, be able to interact with the doctor and choose their own payment modality. And then really through the Uberization of dentistry, be able to actually leave a review for the doctor. And this is something that we feel is really helpful as well. So let's talk briefly about some of the other use cases. We obviously think it's very important to have enterprise solutions so that this is not just a consumer-facing technology. We want a general dentist who gets a patient into their office to be able to immediately upload this information, whether it's intraoral pictures, x-rays, chief complaint, and be able to discuss this case with the dental surgeon, with the periodontist, with an oral surgeon, and be able to get real-time information back from them. What we are seeing here as dentistry continues to consolidate in the United States are traveling oral surgeons and traveling periodontists. And what ends up happening is a lot of these DSOs and dental offices is that the dental specialist will show up once or twice a month. And the workflow is that general dentists will see it, they'll treatment plan the case. Sometimes they'll even have their treatment coordinator discuss pricing, collect payment, and then on the day of when the actual specialist arrives, instead of producing and instead of doing dentistry, the patient has to now go through a second examination. Possibly things are going to be modified and changed. This results in the treatment coordinator now having to go get consent all over again, collect payment. And so this really is decreasing efficiency in a lot of those offices. Well, in many cases, the specialist is able to review, approve, or modify these treatment plans before the patient ever shows up on the day of surgery. And if there are modifications that are required, and even payment, consent forms, all this can be done virtually before the day of. And on the day where the patient is actually there and the specialist shows up, we can actually produce instead of retreatment planning. The other aspect of this is in the referral process. So, it doesn't have to be for on-site specialty work. This is in the traditional, this works really well in the traditional referral process as well, where a dentist can now involve an endodontist, an oral surgeon, an orthodontist, and we can have this collaboration between specialists in different offices and be able to communicate well and make sure the patients are involved as well if necessary, and really have a lot of this workflow and questions done so that when the patient is sent to the specialist, we are increasing efficiency, case acceptance is increased, and the patient has already had the opportunity to meet and greet the specialist. And we thought to ourselves, one of my pain points was waiting for, medical clearances or dental clearances. And so by having a HIPAA compliant platform, we're able to communicate with the medical doctors as well and be able to get medical clearance forms immediately, and also follow that up with electronic referrals between MDs and the dental professional. So the ability for us to utilize this in our communities is really tremendous, and be able to really go to where the patients are located. Just imagine being disabled and imagine wanting to get a cleaning. In America, and even with the advanced technologies and the vast resources we have, an elderly patient or a disabled patient would have to call 1 week in advance and book a transportation to show up, oftentimes with a 3 to 4 hour window, and just to show up to the office, be able to have a cleaning, and God forbid anything runs over and just causes a whole number of other issues with transportation. Well, this particular problem could be addressed with remote dentistry. The dentist oftentimes doesn't even need to go to the actual location to provide the cleaning. By utilizing teledentistry in a lot of states, the dentist is allowed to send mid-level practitioners to elementary schools, nursing homes, senior living centers, and remote areas where the patients are located, and really allow us to bring preventative care to the actual patient instead of forcing the patient to come to the traditional office. And in fact, I believe that in the very near future, as a result of some of the changes that dentistry will face, mobile dentistry will be on the rise, and really will be helpful in seeing some of our patients maybe at the location where they are instead of bringing them to the office. And really a huge point on this, I have found it to be a huge practice booster for my offices. I originally was really against the idea of having mid-level practitioners or hygienists go out and provide hygiene. And we realized that these patients are really happy about saving time and money, and are actually really inclined to come to our offices to get the restorative work done. So I can free up chairs, and I can have 4 or 5 hygienists go out there under my license and on my behalf, and really help patients receive prophies and exams, and be able to take intraoral scans. And I'm supervising everything and making sure everything is done to the standard of care. And the things that cannot be done, I bring them back to my traditional office and I see them there. Another really huge application is going to be remote mentoring and teaching. As a huge advocate of advancing surgery and implantology, I've been really honored and privileged to participate with the Global Dental and Implant Academy and a couple of other organizations in teaching surgery and implants to a lot of dentists who want to learn it. But one of the challenges we had was how to follow up with our students and be able to help guide them through their first several cases and be able to share that information in a HIPAA compliant format, not emails, not texts, and not Facebook closed groups, but really in a HIPAA compliant manner that will allow us to really collaborate and be able to follow up with some of our students. And I imagine that you'll see this in dental schools very shortly as well. And again, the mobile dentistry, I think, is going to be really, really huge. On the Dentulu software, actually, one of the original uses for our software was to recreate an Uber-like feel. So any patient can download the app, immediately make a profile, and look for a local dentist in that area. And so the app would automatically match the patient to a local dentist who provides mobile care in that area. And then the dentist would approve or disapprove of that request. And so the patients could be matched up with a local dentist who can actually travel to their workplace, their home, their hospice, even universities. So again, the logistics is really something to consider for the elderly and disabled patients. And with a very simple setup of a mobile chair, and I'll show you a slide on that actually. This is us performing mobile dentistry on site for Patient Pop here in Los Angeles. Patient Pop is a really well-known company who's actually gotten into teledentistry recently, but we had the pleasure of performing on-site dental cleanings for their staff. So we would show up and we would have a full days of schedule, basically providing PPO patients who already have insurance, prophies, exams, preventative care. You can see on the lower left, we would really change the environment, put on some virtual reality glasses, and all this stuff would be overseen by a dentist, a licensed dentist, who would review all the charts, the probing depths, the intraoral and extraoral pictures, and the x-rays. And we found it to be a very helpful way to decrease the 164 million work hours that were lost. And I imagine that this is going to be a very lucrative and helpful modality for providing dentistry moving forward. Within our company, we want to enable dentists to create these mobile types of practices and to be able to add associates and hygienists to their existing brick and mortar offices. But you'll see a bunch of different business models that are emerging with mobile dentistry. And here's a direct-to-consumer approach, where with a couple of simple chairs, this is like very early on being able to go to a patient's home and provide cleaning services for them by a licensed hygienist, whether it's an RDHAP or an established RDH for an established patient of records. Now, you don't need bulky equipment to utilize teledentistry to oversee mobile dentistry. These equipment can be purchased for $15,000 to $20,000, including the chair, the mobile units, the lights, x-rays. And so while you will see a number of these bigger, costly trucks being implemented in mobile dentistry, I think that this is a simple and scalable and convenient way to implement teledentistry within mobile dentistry. So as we progress into the future, post-COVID dentistry, where aerosolized, particles remain in the air for 3 hours, and we will see definitely new protocols that will help minimize the amount of cross-infection, the amount of aerosolization, and addressing issues such as the coronavirus remaining in the air or remaining on surfaces. I think that it's important to implement teledentistry solutions immediately, to be able to determine whether the patients are at risk, to be able to see if they have any signs or symptoms before having them come into the office, and possibly utilize teledentistry to even provide some of the care remotely if it's not required to come into the office. And so, we hope that we address these issues without implementing the six. One of my board questions was, in what type of space do dentists practice? And the answer was personal space. And that's usually within 6 to 12 inches of the patient. And so the 6-foot rule is not something that's going to work for dentistry. And we hope that teledentistry and mobile dentistry become, more and more involved in providing as much as we can without having the patients come in and be able to help do follow-up. So as dentistry has evolved, and as our tools have evolved over the last several centuries, I think that the technology now that we decide to implement, whether it's artificial intelligence, video conferencing, remote monitoring, will continue to evolve. And I'm excited to see where dentistry goes in the future, where it came from when my grandfather, father were practicing, into where it's going to go in the very near future. And really, no type of progress is possible without change. And so we have to be ready to implement some of these changes. And if we don't do it from within, if we don't start taking some of this technology that's available to us from within dentistry and implementing it with our supervision, at our own intentions, we can be sure that corporations and special interests will do it for us and will bypass our profession and go direct to consumers. And it's very important for me to see us really just go out there and start doing something, whether it's video conferencing, chatting, calling your patient and following up with them, and getting ourselves familiarized and comfortable with this technology. Because if we don't, we will be bypassed, and people will really go direct to consumers and really leave professionals out. And I think this will be really hurtful for not only our profession, but also to our patients. So I thank you. And with that, I'd like to leave my information here. In case anyone wants to follow up and ask any questions, you can contact me on Facebook, on Instagram, or email me directly at arash@dentulu.com. And we'll share some information about our particular company. We have made Dentulu free for the next several months. And in fact, we will continue to have some ongoing free capabilities, probably forever, and allow dentists to really implement to some level some type of teledentistry through Dentulu without having to incur any additional costs. So we hope to add tremendous value to your practices and to your ability to see your patients. But no matter what company you go with, I really recommend that you get involved in teledentistry and really start thinking about how this emerging technologies can be utilized over the next couple of years and the future of dentistry as a whole. So thank you guys so much for your time, and I'll go ahead and take some questions now.
Perfect. Well, first of all, I want to thank you for your time and your passion. It's clear you have a passion for teledentistry as well as for helping share information with your colleagues. So we appreciate that very much. There are some questions, so let me jump right in. One of the first questions was, different insurances have been requesting different coding. I've been billing 9995 and 140. Is that correct?
Yeah, so the two different, so you have to look at, especially in the United States, I think you should really refer to the American Dental Association. They have a wonderful, list of different insurance companies and what each individual insurance company covers. So what Delta and Cigna cover are going to be completely different than what Medicare and Medicaid cover. I would refer back to the American Dental Association's guidelines on that, which you can find on their first page of their website. So just go to ada.org. And the really important note is the two codes, the asynchronous and synchronous teledentistry codes, are ones that you would add in addition to your existing codes. So whilst there are a couple of companies that are paying specifically for those codes themselves individually, most are not paying for the teledentistry, but using the teledentistry codes to designate that particular procedure has been used through the utilization of teledentistry, if that makes sense.
All right, we've got a couple of insurance questions. Would evaluating a simple set of 5 to 6 intraoral photos taken with the patient's smartphone qualify as asynchronous consultation D9996?
Absolutely. I think the store it forward model, whether it's one single radiograph, a video, even if it's probing depths, would constitute asynchronous teledentistry. But I would refer back to the specific insurance with whom you're billing that, because just as you've seen with other procedures such as implants and tooth replacement, every insurance has their own hoops and hurdles to jump through. And I think that's going to be consistent with teledentistry as well. So they'll create certain rules and regulations, and I think each individual insurance company that you are billing for will be able to give you specific guidelines on what constitutes a teledentistry event.
And then and again, this might overlap a little bit, but it says code D9996. What does delivery to the patient on the date of service mean exactly? And can the date of service be a virtual appointment?
Yeah, so the store it forward model will allow you to basically have for example, a mid-level practitioner go out there and collect the information for you. You will be able to review it at a later time in a different physical location, and then be able to send a mid-level practitioner, for example, back out to treat the patient. And so the date that the actual service is delivered, whether it's a prophy or a periodontal exam, on the date where the actual service is completed is when you would bill that particular procedure out.
And I think you answered this, but I'll ask it anyway since it's here. Are insurance companies reimbursing for asynchronous teledentistry? But I think you've answered that.
Yeah, there are several. And Medicare has not only now, paid dentists and physicians, but they've actually relaxed the laws that allow dentists or physicians from one state to treat patients in another. So you can have a lot of those rules and regulations that limited the geographic capabilities of providers have now been relaxed. And we hope that they'll stay relaxed to a certain degree. And then, there's states like Texas that have really outlawed and banned teledentistry. I personally I believe that even some of them don't really have a full understanding of what teledentistry is. And I've consulted several of these, actual boards and healthcare experts, because, true teledentistry involves a telephone. You can call a patient of yours and actually do follow-up care with your patient. That by definition is teledentistry. So you have to go by your state rules and by your insurance rules and make sure that you're not crossing any boundaries. And I also highly recommend that you check with your malpractice carrier as well, and check with them to see what restrictions. As with any emerging technology or modality, you want to make sure you cover your bases and check with not only your state and local governing bodies, but also with your insurance company and malpractice carrier.
Perfect. Here's a Dentulu question. What is the yearly or monthly subscription cost to the dentist?
So the way we have set up our company is that we provide a certain set of features free of charge, and we will continue to do so. And we believe that everyone should have access to this type of technology. So some of our base our base services will continue to be free, such as the video conferencing and chatting. And then we have a la carte options that are specific to the type of practitioner. So some surgeons will want to send and receive DICOM files. Some want to send electronic prescriptions. Some will want integration into their practice management software. And so there's going to be a la carte options and allow dentists to pick and choose what it is they want. But right now we have made our software completely free for the next several months. And going back, our basic features are going to be free. And then the a la carte options are going to range between $99 to $299 per month.
There's another insurance question. It says, and I don't know how you quantify significant, but it says, are you seeing significant reimbursement for 9995 and 9996, one more than the other, one more so than the other?
I think right now the live synchronous is receiving lots of actual payments for the practitioners, and we don't have any in-house practitioners ourselves. We just provide the platform and allow dentists to bill utilizing our platform. And I think a lot of the billers are not familiar with how to bill this properly as well. And a lot of people who decided to bill off of not compliant equipment have been getting rejections and denials. So some of the requirements, for example, that we take into consideration is being able to geotag the location of the patient and the doctor. So where was the location of the patient and where was the location of the doctor, and how could you prove that? Being able to export some of this information, and whether you use just a phone or you use an audio and video are all factors. But there are lots of patients who are utilizing their insurance right now. Cigna, DentaQuest, Delta Dental. So there's tons of them paying for this. It just has to be billed properly. But to answer your question, I think most of the ones that are currently being utilized right now are the synchronous, just because of the geographical barriers. But I think that the asynchronous modalities are going to be really instrumental and popular going forward, especially if the doctors don't want to do a lot of video conferencing. They can still provide second opinions and be able to capture pictures and videos from the patient, and then be able to evaluate them at a later time and give feedback to the patients. And so this is more of the asynchronous modality.
And then we have a question, how do we order a Dentulu intraoral camera?
So we're on back order right now. We have several thousand arriving again. I would recommend right now, the best way to do it is directly through the app. We have a shop on within the app. So you could just go to your cell phone, download Dentulu as a provider, create an account for yourself, and then you can start ordering the cameras there. Our website is going to be revamped in the next week or two, and we will have the shopping capabilities directly on our website, and our Amazon shopping store is going to be up as well. So we are trying to keep up with the demand, and hopefully very soon you'll be able to purchase these in bulk from your supply companies like Henry Schein, Benco, Pearson, and Sky Dental.
Awesome. And then we have a question that says, please describe a common scenario to establish patient of record through Dentulu.
A common scenario to an established patient. So, for me personally, I really started implementing the post-op protocol. So I would do place an implant or soft tissue graft or GBR, and I would give the patient a camera and say, go home with this. And I would, my staff would help them download the app. It would take a couple of minutes and get them set up, and have them go home and take a picture every single day of their extraction site or of the surgical site. And I would be able to send follow-up questions and ask them how they're doing, make sure and send post-op instructions to them, and then be able to follow up with them on the app, whether through a virtual consultation, through video, or through a follow-up phone call, and just make sure they're okay. So that's the way I originally implemented teledentistry really in my practices. Now with established patients, I have a lot of my patients just go home with these cameras. So anytime they have an issue, if it's a chipped crown or chipped porcelain or a healing cap came off, I basically allow them to create a virtual appointment with me based on my availability. So they'll go on my schedule. They'll basically put themselves in the queue. I'll get a notification and say, John Smith wants to talk about, their healing cap. And so, 2-3 days later, I'll be able to have a consultation with them, answer their questions, and be able to then go ahead and export them directly onto my practice management software for an appointment. And another thing that we've been utilizing a lot, and you'll be able to see these as early as June, is the asynchronous model. So a lot of patients of mine who want to go home and discuss things with their family members. So they'll go home, they'll have all the information I gave them in the office available. I will be able to have a conference call with the husband or wife, discuss everything, have my treatment coordinator involved, and then complete the payment, discuss any insurance information, and then schedule them directly to be seen in the office. So that's something that we've been using that's been very helpful, and we're going to release that in our June update to the general public.
And then one question came in that says, if my assistant speaks with the patient, can we still charge for D9995?
So you can charge for triaging the patient but imagine your assistant is a call center. So there are codes where a patient can call a call center, or a patient can call one of your office staff, and then the office staff then forwards the call or communication to you. But you don't want to bill for dental procedures that you are not providing. So you don't want to have your staff providing consultations and then you're charging for that. So you want to practice teledentistry the way you would in a traditional office, and you want to bill for it the way you would in a traditional office. So the procedure should be done by a licensed professional and billed by that provider. So I would say, as a general rule, if you can bill for it in the office, then you should be able to bill for it in teledentistry. So if you're required to provide the consultation yourself, I wouldn't give that, responsibility to a non-licensed professional and then bill for it.
Very fair. And then last is, how do we install the Dentulu chat widget on our websites?
So very simple. You can go to our website and create a profile, or you could do it on your phone. It's a lot easier on your phone. Just download it on your Android or iPhone. And then once you have your username and password set up, you can log in online with the same username and password and copy and paste. There's a code on the left-hand side. It says dental widget on your dashboard. And you just basically copy and paste that code and give that to whoever's doing your website. And they'll be able to implement that widget immediately onto your, a custom landing page or your marketing campaigns or directly on your website. And it'll go live immediately. And any patient that goes to your website will be able to schedule directly into your virtual calendar. And you'll be notified, shortly after they schedule it, and be able to prepare yourself. So whether you want to do a same-day appointment or, set a schedule for a week in advance, patients can now schedule directly with you by going into that widget. But I would log in online as a provider, and then go to the section on the dashboard that says dental widget, copy paste that code and give it to your, whoever your website developer is, and they'll be able to implement that for you immediately.
Very good. And then there's one more question that says, will the tape be available for us to listen to again? And yes, we plan on posting it to the ACE YouTube page, as well as on our LinkedIn. We'll post it on our LinkedIn page as well. So there'll be access in multiple areas to get it. It's being recorded, so that should happen. If not later tonight, it will happen certainly sometime tomorrow.
Wonderful.
Awesome.
Thank you again.
Well, Doctor, yeah, thank you. You're awesome. I love your energy and your passion. As I said, as we've communicated throughout this process, it's never waned. So, you carry the mantra well. So thank you. And thank you for allowing us to be a part of your journey. We certainly enjoy the opportunity. So thank you.
Thank you. And thank your whole team and really everyone listening. This too shall pass, and we will adapt and really continue to flourish and really advance dentistry. And I'm really fortunate and honored to be a part of it. So thank you for this opportunity.
Excellent. Well, everyone have a great evening, and thank you for being a part of tonight's webinar. And again, thanks to Dr. Hakamian for his energy. We really appreciate it. Have a wonderful night. Thank you.
Thank you.